Type 1 diabetes versus type 2 diabetes. Type 1 diabetes is caused by an autoimmune response. The cells are starved of glucose since there is no insulin. So this means there's no insulin to bring the glucose into the cells, leaving them starved. You can remember this by thinking type 1, we have none. Now for type 2 diabetes. This is when the body does not produce enough insulin, or the insulin that is produced doesn't work properly. We call this insulin resistance. You can remember this by the memory trick. Type 2, think technical difficulty with the insulin. Type 1 diabetes is usually diagnosed during childhood, and type 2 diabetes is usually diagnosed later in adulthood. This is easy to remember because childhood comes first, aka type 1 diabetes, and adulthood comes second. You can think type 2 diabetes. Now for the causes. Type 1 diabetes is usually due to genetics or family history. Again, this is caused by an autoimmune response, where type 2 diabetes is usually due to a poor diet, sedentary lifestyle, and obesity. Type 1 diabetes has one treatment. It's insulin. These patients are going to be insulin dependent for life. Where type 2 diabetes, you can think it has 2 or more treatments. It can be managed with diet and exercise, oral hypoglycemic agents like metformin, and possibly insulin. Depending on the severity of type 2 diabetes, insulin may be started or increased in times of stress, surgery, or sickness.